Welcome to the M3 Academy, and we are starting the pharmacology session on the autonomic nervous system. We already covered the beta blocker mnemonic session. Yes, and we already uploaded the pre-test question on our website and also the app. Those enrolled in the testing of our Android app, they can also solve the question from the app, or you can sign up from the website m3academymnemonics.com and you can attend the pre-test. These all the pre-test question are high yield question. Yes, all the pre-test question are high yield and based on the previously asked question. So you have to attend and many mnemonics are given in the explanation of those questions. Yes, so please comment about the audio visual so we can start the session. Yes, yes, so we are discussing cholinergic, anticholinergic, alpha blocker, beta blocker, adrenergic, anti-adrenergic, this type of the topic today. Yes, so please give me response about the audio visual so we can proceed with the session. Yes, this audio is good. Now, so the nervous system is divided. Yes. Yes, so nervous system is divided yes in two parts, central nervous system and the peripheral nervous system. Peripheral nervous system divided in autonomic nervous system and the somatic nervous system. Autonomic nervous system further divided sympathetic and parasympathetic, and we already conducted a short session on sympathetic and parasympathetic. Yes, you can revise that session also. So sympathetic को ही अपन बोलते हैं thoracolumbar outflow, thoracolumbar outflow, or you can say T1 to L2. So how you can remember thoracolumbar T and L? Just write 1 and 2. So 1 and 2. So T1 to L2, thoracolumbar outflow. Now parasympathetic nervous system is craniosacral outflow, and we already know the cranial nerve, parasympathetic cranial nerve 3, 7, 9, 10. Yes, vitamin K dependent clotting factor 2, 7, 9, 10. Yes, and parasympathetic cranial nerve 3, 7, 9, 10. Mixed cranial nerve 5, 7, 9, 10. Yes, and pharyngeal arches cranial nerve again 5, 7, 9, 10. And NTS क्या होता है? NTS 9, 10, 7. Yes, nucleus ambiguous 11 plus 9, 10, 9, 10, 7. So these are the magic number. You can attend the magic number session from the topic group we already uploaded. Yes, so sympathetic को क्या बोलते हैं अपन? Thoracolumbar outflow. And preganglionic receptor in the both system is NN, and preganglionic neurotransmitter in the both system is acetylcholine, and postganglionic receptor in case of the sympathetic is alpha or the beta, और parasympathetic में होते हैं muscarinic और the nicotinic. Postganglionic neurotransmitter is noradrenaline in case of the sympathetic system. Yes, so sympathetic noradrenaline, parasympathetic acetylcholine. But here is a few exception. Yes, yes. So in the kidney, in the renal system, there is a dopamine, and sweat gland, there is a acetylcholine. Yes, so we already discussed this. So in the sympathetic ganglion is closer to spinal cord. So how we can remember sympathetic समीप होता है spinal cord के, समीप मतलब पास में, spinal cord के थोड़ा समीप होता है, और इसके प्री गैंग्लियोनिक फाइबर शॉर्ट होते हैं और पोस्ट गैंग्लियोनिक फाइबर यहाँ पे लॉन्ग होते हैं. तो प्री इज अ शॉर्टर वर्ड, प्री इज अ स्मॉल वर्ड, सो स्मॉल फाइबर. पोस्ट इज अ बिगर वर्ड देन द प्री, सो लॉन्ग फाइबर. प्री में कितने अल्फाबेट आते हैं? 1, 2, 3. पोस्ट में कितने अल्फाबेट आते हैं? 1, 2, 3, 4. सो प्री इज अ शॉर्ट, पोस्ट इज अ लॉन्ग. यस, नाउ द पैरासिम्पैथेटिक नर्वस सिस्टम. यस, इन केस ऑफ द पैरासिम्पैथेटिक, पैरा मींस प्यार. तो इसको गैंग्लियन, इसको जो इफेक्टर ऑर्गन होता है गैंग्लियन को, उससे काफी ज्यादा प्यार होता है. इसलिए यहाँ पे जो जो गैंग्लियन होता है इफेक्टर ऑर्गन के पास में चला जाता है. यस, सो गैंग्लियन क्लोजर टू द इफेक्टर ऑर्गन. यू कैन रिमेंबर लाइक पैरासिम्पैथेटिक प्यार मींस लव, सो पैरासिम्पैथेटिक सिस्टम इज अ लव टुवर्ड द इफेक्टर ऑर्गन, सो क्लोजर टुवर्ड द इफेक्टर ऑर्गन, और यू कैन जस्ट अपोजिट टू द sympathetic system. Yes, so preganglionic fiber are longer and postganglionic fiber are the shorter in the parasympathetic system. Yes, now next, so you can easily appreciate by this schematic diagram. This is preganglionic fiber, this is ganglia, this is postganglionic fiber, neuroeffector junction, and the effector cell. In case of the autonomic nervous system, somatic nervous system, only motor neuron is present, neuromuscular junction is present, and skeletal muscle is present. Yes, now, so we easily say in parasympathetic system, the parasympathetic system, the ganglion love to effector cell. So ganglion closer toward the effector cell. So preganglionic fiber are longer, postganglionic fiber are the shorter. Yes, sympathetic system, the postganglionic neurotransmitter is noradrenaline, but in case of the sweat gland is acetylcholine. In case of the renal, it is dopamine. We already see this now. So we already know the difference, sympathetic and parasympathetic system, the difference. You can see this picture and easily understood the symptoms. Yes, the features, sympathetic and the parasympathetic. So in the sympathetic system, fight, fright and the fear. You can remember heart rate increase, force of contraction is increased, eyes dilated, mydriasis, bronchodilation, yes, and decrease GI motility, sphincter tone increase, and sympathetic, you can remember S for shoot, S for sympathetic system, S for shoot. Shoot means ejaculation. So ejaculation किसमें होता है? ये होता है sympathetic में. Parasympathetic P, P means you can say pointed penis means the erection is there. Yes. Rest of the feature are just opposite to the sympathetic nervous system. Now, yes. Yes. So next thing is the synthesis of the acetylcholine. So synthesis of the acetylcholine, you can say this choline uptake in the cells. Yes, by the choline esterase transferase. Yes, and this is a rate limiting enzyme of this stage and inhibited by hemicholine, inhibited by the hemicholine. Yes. हेमिकोलिन से ये इनिबिट होता है हेमिकोलिनियम. सो कैसे याद कर सकते हो, हमें तो कोई अंदर ही नहीं आने देता. हेमिकोलिनियम मीन्स हमें तो कोई अंदर ही नहीं आने देता, हमें तो कोई अंदर ही नहीं आने देता, हमें तो मीन्स हेमिकोलियम. हेमिकोलियम इनिबिटेड दिस फर्स्ट स्टेप. दिस इज रेट लिमिटिंग स्टेप. This is rate limiting step. Yes. Now, so next you can say this acetylcholine after synthesis uptake in the vesicles, and this vesicle uptake is inhibited by the vesamicol. Vesamicol. So as the name suggests, vesicle vesamicol. So vesicle uptake is inhibited by vesamicol. Vesamicol. Now, so release of the neurotransmitter is inhibited by the botulinum. So botulinum block. Before botulinum, before block the release. Yes. बिफोर बाहर निकलना. सो बोटुलिनम क्या करता है, जब एसिटाइलकोलिन बाहर निकलता है तो उसको ब्लॉक कर देता है. बिफोर बोटुलिनम, बिफोर बाहर निकलना, बिफोर ब्लॉक, बंद कर देता है. तो ये भी आप यहाँ से देख सकते हैं और ऐसा डायग्राम एग्जाम में आ सकता है, उसमें ए बी सी डी करके पूछ सकते हैं. In the examination, examiner can give the A, B, C, D type the presentation and ask about the drugs. Yes. Now, so hemicolium block the choline uptake. This is rate limiting step in the synthesis. Yes, so hemicolium हमें तो कोई अंदर ही नहीं जाने दे रहा है. Yes, and yes. Now vesicular transport, vesicular associated transporter is blocked by vesamicol. So you can easily understood by vesi. Sam pronunciation यहाँ पे हो रहा है. And two toxin affect the release. Yes, release means बाहर निकलना. बाहर निकलने को कौन ब्लॉक करता है यहाँ पे? बोटुलिनम. Yes. तो टू टॉक्सिन यहाँ पे ब्लॉक करते हैं, बोटुलिनियम टॉक्सिन एंड वाइट ब्लैक विडो स्पाइडर टॉक्सिन. सो देयर में बी a diagram of the spider in examination, they can ask about this. Yes, so they induce massive release and this release causes the depletion. So botulinum causes block the release, but the spider causes massive release, so depletion. Yes, so botulinum toxin, there is a two type, A and a B. This is highly potent exotoxin. Yes, and botulinum food poisoning. In normal food poisoning, there is a diarrhea, but in this food poisoning there is a constipation. Yes, so please remember this point. इस food poisoning में क्या होगा? इसमें होगा constipation. Yes. Now, so botulinum toxin A, इसको अपन बोलते हैं botox, and uses is ABCD. Yes, what is the uses of this botox? F for axillary hyperhidrosis, B for blepharospasm and beauty treatment like removal of the age-related wrinkles, cerebral palsy, mainly spastic type, cervical spasmodic dystonia, and you can say strabismus, spasmodic torticollis, post-stroke spasticity, spasmodic dysphonia, hemifacial spasm, and nystagmus. So these are the use of the botulinum toxin. You can easily remember by the ABCD. ABCD करके याद कर सकते हो. Auxiliary hyperhidrosis, blepharospasm, cervical palsy, mainly spastic type, or strabismus, spasmodic torticollis. Yes. So please remember this. This is not a flaccid. This is a spastic. क्योंकि ये flaccid paralysis करता है तो spastic condition में इसको use में लेते हैं. Yes. So can anybody tell me which type of the paralysis seen in botulinum? Yes, ascending, descending, bilateral. Yes, किस तरह का यहाँ पे type in the chat box which type of the paralysis seen in the botulinum? Yes. Type of the paralysis seen. Yes, descending, ascending. Yes, we already conducted the mnemonic session on this. Yes, so your exam is so much near. You have to revise, start revising the topic group. So many mnemonics we given on the previously asked topics. Yes, botulinum. Yes, descending or ascending, bilateral or the unilateral. किस तरह का क्या होता है? Yes. Now. So you have to revise that session. Now, so ona botulism toxin A prevent the chronic migraine headache in adults. Yes. So in every 12 weeks we have to give the injection. So mnemonic is oh na ye headache फिर से ना होना oh na ye headache फिर से ना होना means oh na botulinum ये बुरी तरह का headache दोबारा से नहीं चाहिए. Yes. Now next you can say yes. So this picture is taken from the KD Tripathi. Yes, so there is a two type of the acetylcholine esterase. Yes, so again we see in this diagram, this acetylcholine is degraded by the acetylcholine esterase. Yes, and if you inhibit this acetylcholine esterase, we can increase the concentration of the acetylcholine. इस acetylcholine esterase को यदि inhibit करेंगे तो acetylcholine की concentration को बढ़ा सकते हैं. So acetylcholine esterase are two type, true and a false. Yes, true acetylcholine esterase and a false means you can say pseudo acetylcholine esterase or you can say butyrylcholine esterase. Yes, yes. So acetylcholine esterase found in all cholinergic sites. So you can say A4 acetylcholine esterase, A4 found in all cholinergic site like RBC and the gray matter also. And this is degraded by the very fast. Yes, काफी speed से degrade होता है यहाँ पे. Yes, very fast and the function is termination of the acetylcholine action. Yes, butyrylcholine esterase, also known as a butyl, another name is the pseudo. So it is found in the plasma. Found in the plasma. The next letter of the plasma is the L. So L4 you can say also found in liver. The next alphabet of the liver is I. So I for intestine. And next alphabet of intestine is S. S for you can say सफेद means white matter. सो कहाँ कहाँ पे बुटाइलकोलिन एस्ट्रेज मिलेगा ये आपको पता चल चुका है. यस, जस्ट रिमेंबर प्लाज्मा. नेक्स्ट पी के नेक्स्ट क्या आता है? एल फॉर लीवर. एल में नेक्स्ट क्या आता है? आई फॉर इंटेस्टाइन. इंटेस्टाइन में क्या आता है? एस फॉर सफेद मीन्स व्हाइट मैटर. सफेद मीन्स व्हाइट मैटर. नाउ सो यू कैन से यहाँ पे मेथाकोलिन इज नॉट हाइड्रोलाइजेज बाय द बुटाइलकोलिन एस्ट्रेज. तो मेथाकोलिन मना कर देता है हाइड्रोलाइसिस से. एम फोर मेथाकोलिन एम4 मना कर देता है. तो ये आपको याद रहेगा. और ब्यूटाइल कोलिन एस्ट्रेज बी फोर ये हाइड्रोलाइज करता है बी वालों को. बी वाली चीजें कौन कौन सी यहाँ पे? बेंजाइल कोलिन एंड ब्यूटाराइल कोलिन. तो ब्यूटाराइल कोलिन ट्रांसफेरेज बी वालों को हाइड्रोलाइज करता है जैसे कि नाम में आ रहा है. तो स्टाइल कोलिन उनको नहीं करता है. नाउ सो कौन कौन से रिसेप्टर होते हैं यहाँ पे? यस, मस्करिनिक रिसेप्टर आर M1 M2 एंड M3. यस, सो हाउ यू कैन रिमेंबर द एक्शन ऑफ दिस? यस, यू कैन सी दिस डायग्राम. पहले खाओ फिर दिल लगाओ, बाकी सब काम बाद में. पहले खाओ फिर दिल लगाओ, बाकी सब काम बाद में. पहले खाओ मीन्स first you have to eat, then you attach your heart, then the rest, you have to do rest of the work. So first you have to eat means the gastric gland and the gastric gland. Then you attach your heart means M2 receptor on the heart, and rest of the things M3 receptors. Yes, so you can easily say which type of the receptor. IP3 receptor is eyes look like 1 and 3 is 3. So M1 and M3 receptor follow the IP3 mechanism of action. Yes, IP3 DAG. Yes, so how you can remember IP3? Eyes look like 1, 3 is 3. So odd number 1, 3, 5. 1, 3, 5. The mechanism is IP3 DAG, or you can say increase cytosolic calcium. Yes, phospholipase A2 and the prostaglandin synthesis. इन पर ये काम कर दे. And M2 receptor, GI or G0, GPCR, the protein couple receptor. Yes, now, so The agonist, you can say M1 का agonist कौन होता है? The M1 agonist is oxotrimorinine. Oxotrimorinine. So we can remember oxotrimorinine OOO. इसमें कितने सारे O आते हैं? 1 2 3 O for 1 1 और M for M. So M1 किसके लिए होता है? M1 के लिए होता है. नेक्स्ट एंटागोनिस्ट कौन होते हैं इसके? पायरेंजेपाइन एंड टिलेंजेपाइन. यस, पायरेंजेपाइन एंड टिलेंजेपाइन. पायरेंजेपाइन एंड टिलेंजेपाइन. यस, सो कहाँ यूज में आएगा? M1 रिसेप्टर पहले खाओ मीन्स गैस्ट्रिक ग्लैंड में. सो दिस एंटागोनिस्ट इज यूज फॉर दी. यस, दिस एंटागोनिस्ट इज यूज फॉर ट्रीटमेंट ऑफ दी पेप्टिक अल्सर्स. यस, ट्रीटमेंट ऑफ दी पेप्टिक अल्सर. सो पायरेंजेपाइन टिलेंजेपाइन P4 कहाँ पे यूज आएगा? P4 पायरेंजेपाइन P4 यूज इन द पेप्टिक अल्सर. यस, डायरेक्टली क्वेश्चन पूछ सकते हैं यहाँ पे. सो P4 यू कैन से पेप्टिक अल्सर ट्रीटमेंट. यस, इनके एंटागोनिस्ट यहाँ पे काम में आएंगे. नाउ M2 रिसेप्टर्स. यस, प्लीज वेट. यस, सो पायरेंजेपाइन कहाँ पे यूज होती है? यस, कमेंट सेक्शन में बताएंगे. वेयर दिस पायरेंजेपाइन इज यूज इन द पेप्टिक अल्सर. यस, एंड M2 रिसेप्टर. यस, M2 अगोनिस्ट इज मेथाकोलिन. अगोनिस्ट इज मेथाकोलिन. सो कैसे याद कर सकते हो? मेथाकोलिन. मेथाकोलिन में क्या आ रहा है? M4 M और था मीन्स 2. सो M2 F4 अगोनिस्ट. सो मेथाकोलिन क्या है? मेथाकोलिन इज M2 अगोनिस्ट एंड एंटागोनिस्ट इज मेथोट्रीमाइन एंड ट्रिप्टामाइन. Now, so next is M3 receptor. M3 receptor agonist is bethanacol. Bethanacol. So this B, when you write the B in B, you can easily find the three. So you can say bethanacol is M3 receptor agonist, and the antagonist is solifenacin and derifenacin. Solifenacin and derifenacin. So bethanacol, betha is look like the bathroom. Bathroom means it increases the urinary frequency, means use in the retention of the urine, and antagonist is used in the overactive bladder. Just you can do opposite. So यहाँ पे क्या देख सकते हो? बेथानाकोल मतलब बाथरूम, मतलब ये क्या बढ़ाएगा? यूरिन की फ्रिक्वेंसी को बढ़ाएगा. और इसके रिसेप्टर का एंटागोनिस्ट कर दो सोलिफेनासिन डेरिफेनासिन. सो ये क्या करेंगे? ओवर एक्टिव ब्लाडर में यूज आएंगे. यस, सो इस तरीके से आप यहाँ पे देख सकते हैं. सो M3 रिसेप्टर बाकी जगह मिलते हैं. यस, सो क्या क्या करते हैं? सिलियरी मसल में कॉन्ट्रेक्शन, एक्सोक्राइन ग्लैंड में सिक्रेशन. यस, एंड वेस्कुलर एंडोथेलियम से एनो रिलीज करवाते हैं और वेसोडाइलेशन होता है. सो एवरीवेयर इट कैन वेट. यस, इट वेट द ग्लैंड्स, इस कंस्ट्रिक्टर ग्लैंड्स एंड रिलीज द सिक्रेशंस. यस, सब जगह गीला गीला कर देंगे यहाँ पे. सो जितने भी सिक्रेशन होंगे वो सब यहाँ पे बढ़ जाएंगे. यस, तो जस्ट रिमेंबर दिस. पहले खाओ फिर दिल लगाओ, बाकी सब काम बाद में. नाउ, सो देयर इज अ टू टाइप ऑफ द निकोटिनिक रिसेप्टर, NM एंड NN. यस, NM. M मीन्स न्यूरोमस्कुलर जंक्शन पे होते हैं. NN मीन्स द ऑटोनोमिक गैंग्लिया पे होते हैं, इन द ऑटोनोमिक गैंग्लिया. यस, एंड अगोनिस्ट इज NN. NM मीन्स निकोटीन, और दोनों में निकोटीन ही होते हैं. एंटागोनिस्ट यहाँ पे याद करना है. न्यूरोमस्कुलर ब्लोकर कौन कौन से होते हैं? ट्यूबोकुराइन. और एनएन के ब्लॉकर कौन है? हेक्सामेथोनियम एंड ट्राइमेटोफॉन. हेक्सामेथोनियम एंड ट्राइमेटोफॉन. यस, we will see in the ganglionic blockers. So next is the cholinergic drugs. So you have to develop a habit for the at least revising five pharmacological drug classification every day, and you can summarize the total pharmacology drugs features in the classification. Yes, so you have to draw the classification and write the important previously asked points and important variables on the drug itself on the classification. सो आपको रोज का 5 क्लासिफिकेशन याद करना है और उनके जो भी फीचर है उस क्लासिफिकेशन में ड्रग के सामने लिख देने हैं, जो भी आप चीजें भूलते जा रहे हैं. यस, सो कोलिनर्जिक ड्रग्स. कोलिनर्जिक मीन्स द कोलिनोमाइमेटिक और पैरासिम्पेलेटोमाइमेटिक ड्रग्स. Yes, this is the classification. So these are the directly acting drugs. Directly acting drugs is a cholinesterase and alkaloid. Cholinesterase, just remember ABCD: acetylcholine, beta-col, C means carbet, कोल एंड मेथाकोलिन. यस, एल्केलॉइड कौन कौन से होते हैं? PM होते हैं, पाइलोकार्पिन, मस्करीन एंड अरेकोलिन. So these are the directly acting. Indirectly acting means the enzyme which degrade acetylcholine, that the drug inhibit that enzyme. एस्टाइलकोलिन एस्टरेज, एंटी एस्टाइलकोलिन एस्टरेज, यस उस एंजाइम को इनहिबिट करती है तो क्या बोलेंगे, एंटी एस्टाइलकोलिन एस्टरेज, सो दिस ड्रग आर एक्टिंग इनडायरेक्टली। यस, तो कौन कौन से आते हैं इसमें, रिवर्सिबल एंड इरिवर्सिबल, इरिवर्सिबल थिंग्स आर मेनली पॉइजन, यस कोई भी चीज रिवर्सिबल नहीं हो रही है मतलब वो क्या है, पॉइजन, यस। सो रिवर्सिबल में क्या क्या आते हैं, कार्बामेट, नॉन कार्बामेट, यस, सो इसमें मेनली थेरापेटिक ड्रग्स आती है, फाइजोस्टिगमाइन, नियोस्टिगमिन, पाइडोस्टिगमेन एंड रिवास्टिगमेन, सो स्टिगमिन स्टिगमिन लास्ट में लगेगा यहाँ पे, और एंड्रोफोनियम, टेक्रिन, डोनेपेजिल एंड गैलेंटामाइन। इरिवर्सिबल में मेनली पॉइजन आएंगे, यस सबको पता है ओपी पॉइजन, सो यहाँ पे डिफ्लोस, इक्थियोफेट, मेलाथियोन, पैराथियोन, मेलाथियोन, the story we already discussed. Yes, please revise the insecticide session. In the topic go from pharmacology section, there is a insecticide mnemonic session. We already discussed too many insecticides. Yes. Now, carbamates, carbamate, the name has a car, carbaryl and propoxer. So, proper car means propoxer and carbaryl. Yes. So these are the example. Now, so we already discussed this choline esterase, acetylcholine esterase work on the all side. Yes, on the all hydrolyzes by the all enzymes. Yes, and this is the non-selective. So A4 acetylcholine A4 work on the all means non-selective. Now methacholine, methacholine मना कर देता है ब्यूटाइलकोलिन एस्ट्रेस से या फिर ये सुडोकोलिन एस्ट्रेस से हाइड्रोलाइज नहीं होता है। Carbachol C4 you can say combined activity, so it has the both activity muscarinic and nicotinic. And bethanacol means bathroom means it act on the bladder, and bethanacol not hydrolyzes by the acetylcholine esterase or butyrylcholine esterase. So bethanacol बिना हाइड्रोलाइसिस का होता है, बी फॉर ब्लॉक हाइड्रोलाइसिस, बिना हाइड्रोलाइसिस का होता है, और इसमें निकोटिनिक एक्टिविटी भी यहाँ पे नहीं होती, ये चीज यहाँ पे पूछ सकते हैं। यस, सो नेक्स्ट थिंग इज मेथाकोलिन, मेथाकोलिन M4 receptor on the myocardium, so M4 methacholine, M4 myocardium, we know पहले खाओ फिर दिल लगाओ मीन्स M1 M2, सो हार्ट पे कौन सा रिसेप्टर होता है, M2. So maximum action on the myocardium, methacholine challenge test we can do for the bronchial asthma. We can do for the bronchial asthma. Now difference between physostigmine and neostigmine. Yes. So neostigmine, you can remember neostigmine N for neostigmine, and for new drug. New drug means this is the synthetic drug. And this is a quaternary ammonium compound. So N4, this is not cross the blood-brain barrier. So this drug not having any central effect, and no central effect, and not a good oral absorption, and this is quaternary ammonium compound. So any quaternary ammonium compound, quaternary means is a big compound, so it has a big size, so poor penetration means it cannot cause a blood-brain barrier, it cannot absorb orally. Yes, so there is so many common features in the quaternary ammonium compounds. Yes, so just remember N for neostigmine, M for neo means the new means the synthetic drug, N for not cross blood-brain barrier, N for no central action, N for not a good oral absorption. Yes, so quaternary ammonium compound, poor penetration. Yes, so it also not effective topically. Yes, so where we use this neostigmine, it used in the neuroparalysis type, the cobra or carrot bite. Also the neuromuscular diseases like myasthenia gravis and the curare poisoning, पोस्ट ऑपरेटिव यूरिनरी रिटेंशन, पैरालिटिकल इलियकस, इन सब में इसको यूज करते हैं। नाउ द फिजोस्टिगमिन जस्ट अपोजिट फीचर, लाइक दिस इज अ नेचुरल, दिस कैन क्रॉस द ब्लड ब्रेन बैरियर, दिस कैन इफेक्टिव orally etc. So uses in the atropine or belladonna poisoning or the glaucoma. Yes, now next drug is donepezil. So donepezil, in the donepezil is a DO. Just opposite DO is OD. OD means once daily dosing. So this drug having the once daily dosing. So it work for the longer duration and use in the Alzheimer disease. So how we can understood this donepezil? Done OD. DO को उल्टा करेंगे so OD बनेगा once daily. D for duration. So it work for the longer duration, and it used for the AD Alzheimer disease. Yes, and we already conducted the mnemonic session on the psychopharmacology. Psychopharmacology is very important topic. Yes, we covered A to Z psychopharmacology. Yes, so you can revise Alzheimer, delirium, Alzheimer, depression, yes, psychosis, सारी चीजें आप यहाँ पे रिवाइज कर सकते हैं. So just go to the topic group pharmacology section. There is a topic and a link available from the psychopharmacology. Now, next drug is pyridostigmine has a read. Read means the treatment. So this drug used for the treatment of the myasthenia gravis, and read means the um, for the treatment. D for duration. So these are the longer acting. Now, androphonium has a D for it used for the diagnosis of the myasthenia gravis, and DO means the दो. तो 2 mg इसको यूज में लिए जाते हैं, 1 to 2 mg IV इंजेक्शन देते हैं. If condition improve, this is myasthenia gravis. If condition is worsen, this is cholinergic crisis. So in this way, we can differentiate myasthenia gravis from the cholinergic crisis by this androphonium. So just remember pyridostigmine में क्या आता है, रीड मीन्स ट्रीटमेंट के लिए यूज आती है. एंड्रोफोनियम में क्या आता है, डी फॉर द डायग्नोसिस के लिए यूज आती है. और डी फोर क्या पढ़ोगे, दो दो मीन्स 1 से 2 mg आईवी देते हैं इसको. इस टेस्ट को अपन बोलते हैं टेंसलोन टेस्ट. यस, दिस टेस्ट इज कॉल्ड एज अ टेंसलोन test. Now, so next drug is the tacrin. T4, you can remember, this is the toxic. So this trick applied in so many things in pharmacology. Anywhere T, the drug may be toxic. Yes, so you have to tell in the chat box और कहाँ आपने T वाली drug पढ़ी है जो toxic थी. Yes. So this is hepatotoxic and also cause diarrhea and frequent dosing requirements. So this drug not preferred. Yes, now. So in glaucoma, which drug we use? Pilocarpine, physostigmine, and ichthyophat. So ichthyophat has a E for eye. So this is used in condition of the eye, means the glaucoma. Now Sjogren syndrome. Sjogren syndrome started from the S for suka. Suka. So इसमें eye में क्या हो जाता है? Dryness. So we have to use पानी यूज करेंगे. पानी मीन्स पाइलोकार्पिन एंड सेविमिलोन. सो सेवा करेंगे पेशेंट की. सो पाइलोकार्पिन एंड सेविमिलोन यूज फॉर द जोगरेन सिंड्रोम. नाउ मशरूम पॉइजनिंग. सो मशरूम पॉइजनिंग को बोलते हैं माइसेटिज्म. And the type of the mushroom poisoning is muscarine type, means the early mushroom poisoning by the inocybe. So this I and E is pronounced like similar. So inocybe early mushroom poisoning. Treatment is atropine. Now hallucination type is the Amanita muscarina. Amanita में क्या आता है? Anita, this is the name of the girl, and you can just start hallucination by seeing this girl. You can remember like this. So hallucination किससे होता है? Amanita muscarina से and psilocybe से. Yes. So there is a no specific antidote. Atropine is contraindicated because atropine can cause the delirium. Yes, so atropine is contraindicated. This thing is important here. Atropine is contraindicated in Amanita muscarina. So how we can remember this? Yes. So when you write Amanita, yes, when you write Amanita muscarina, A for atropine, F for atropine और M for मना है. तो एट्रोपिन मना होता है यहाँ पे. एट्रोपिन मना है मीन्स वी atropine is contraindicated. Yes, atropine is contraindicated. Yes. Now, next is phyllodean type. Phyllodean type. This is the late mushroom poisoning. Phyllodean type is a late mushroom poisoning. So कैसे याद कर सकते हो यहाँ पे? फाइलोडियन इज अ डबल एल मीन्स द लेट. सो दिस इज द लेट मशरूम पॉइजनिंग. एंड ये किससे होता है? ये भी अमेनिटा फाइलोइड से होता है. एंड पी फोर यू कैन रिमेंबर, पी फोर फाइलोइड, पी फोर इट इनिबिट द प्रोटीन सिंथेसिस एंड द आरएनए. सो जस्ट रिमेंबर बाय द नेम फाइलोइड टाइप, पी फोर प्रोटीन सिंथेसिस इनिबिट मीन्स आरएनए इनिबिट. एंड इसमें आता है डबल एल फॉर लेट मशरूम पॉइजनिंग एंड अमेनिटा फाइलोइड्स. यस. Now, so antidote is thioacetic acid for this phylloid. So antidote is thioacetic acid. Yes. So these are about the cholinergic drugs. Yes. Now time for the active recall. Just type in the chat box. Yes. In this type of the mushroom poisoning, the atropine is not effective. Yes. And what is the use of the ona-botulinum toxin A? Yes. Type in the chat box. Use your active recall memory. Yes. What is the use of the ona-botulinum toxin? Yes. एंड किस तरह की मशरूम पॉइजनिंग में एट्रोपिन कॉन्ट्राइंडिकेटेड होता है, और कॉन्ट्राइंडिकेटेड क्यों होता है ये भी आपको कमेंट सेक्शन में बताना है. यस. Those attending this session live, kindly type your answer in the chat box. Now, So next is the classification of the anticholinergic agent. Yes, so please develop a habit of the revising at least five pharmacological drug classification every day. Write the pharmacological drug classification without seeing your notebook. Yes, your 50% of the question you can solve by the classification itself. Yes. So now, so classification of the anti-muscarinic drug or anticholinergic drug, you can say this is muscarinic receptor antagonist or atropinic drug or parasympathetolytic drug. Yes. So natural alkaloid, they are like belladonna means atropine, scopolamine or the hyoscine. Semi-synthetic like hyoscine, butyl bromide, homatropine is a mediatoric, ipratropium bromide, triotropium bromide used in the bronchial asthma. And please revise the bronchial asthma mnemonic session we already conducted using the first aid also. Yes, now. So synthetic में क्या आता है? Mediatoric is cyclopentalate and tropicamide. Used in peptic ulcer. P4 you can remember pyrangiapine, telangiapine, clinidium and propanthelin. Yes. So just match the P form the P4 peptic ulcer, P4 pyrangiapine, P4 propanthelin. Yes. Why this? Because M1 receptor present on the gastric gland. If you inhibit this M1 receptor, this is used in the peptic ulcer. Now. So used as an antispasmodic, dicyclomine, valethamate, fluoxetine, oxybutynine, tolterodine, and derifenacin. Yes, and pre-anesthetic agent is glycopyrrolate. We already know this inhibit the bronchial secretions and also decrease the reflex activity by GA, general anesthesia. Used in the drug-induced Parkinsonism like benzhexol, like the benzhexol, trihexyphenidyl, benzotropine, piperidine, procyclidine, used for the drug-induced Parkinsonism because drug block the receptor because this antipsychotic drug block the dopamine receptor. So we only correct the acetylcholine part of the Parkinsonism. Yes, and these drugs are very important. Every year there is a question on this centrally acting anti-Parkinson drug, centrally acting anticholinergic drug. Please remember a 2J name of this drug: benzhexol, trihexyphenidyl, benzotropine, piperidine, procyclidine. Yes, and we must give this drug with the antipsychotic to avoid the drug-induced Parkinsonism. Yes, now next is the tertiary amine like dicyclomine, velathamate, and pyrazapine. Vesico-selective drug like oxybutynine, fluoxetine, and tolterodine. So this is the soft bladder drug. सॉफ्ट ब्लैडर इज अ निमोनिक आगे देखेंगे इस निमोनिक में क्या क्या आता है यस नाउ कंपैरिजन बिटवीन एट्रोपिन एंड हायोसिन सो एट्रोपिन कहाँ से मिलता है एट्रोपिन एट्रोपा बेलोडोना दतूरा स्ट्रोमोनियम से मिलता है एंड यू कैन से सीएनएस में इसका एक्साइटेटरी इफेक्ट होता है सो एफ फॉर एट्रोपिन एफ फॉर एक्साइटेटरी इफेक्ट इन द सीएनएस बट द हायोसिन हैज अ डिप्रेसेंट इफेक्ट ऑन द सीएनएस yes hyoscine has a depressant effect on the cns now atropine is a more potent on the heart bronchial muscle and hyoscine more potent on the eye and the secretory gland so how we can remember hyoscine को लिखेंगे high means high HIEE so this more potent on the eye and it has a S for secretory gland. So this is more potent on the eye and the secretory gland. Yes, and hyoscine is the short duration of the action because hyoscine is the S or S4 you can say this is the short duration of the action. यहाँ पे लिख लेते हैं short duration of action. Yes, short duration of the action. Yes. And atropine में क्या आता है? Atropine as a T4 you can remember time. So this is the long duration of the action. Yes, long duration of the action. So in this way we cover the difference between atropine and hyoscine. Just remember atropine में क्या आता है T for the time. So this is longer acting. Hyoscine is the S for shorter acting. High means I means S means this is more potent on the eye and the secretory glands. Yes. एंड एक और चीज यहाँ पे है डिप्रेसेंट ऑन एक्शन ऑन द CNS. Yes. Now, so what is the common properties in the quaternary ammonium compounds? Yes. So we see that like neostigmine is a quaternary ammonium compound. We already see. So what is the common feature in any quaternary ammonium compound? Yes. So quaternary ammonium compound. Quaternary means a bigger size. Bigger size. You can say quaternary ammonium compound means a bigger बिगर साइज, anything बिगर साइज which has incomplete oral absorption, कोई भी चीज बड़ी भारी चीज होगी तो इतना आसानी से absorb नहीं हो पाएगी, तो उसमें क्या होगा, incomplete oral absorption, poor penetration in the brain, the bigger thing cannot enter in your brain, cannot enter in your eye, cannot enter in your intestine, so this is a poor penetration in brain, eye, so central and ocular effect are not seen, yes, and elimination is slower because this is a more bigger molecule, more fatty molecule, so elimination is slower, so action is longer. Now, so having higher nicotinic blocking property and also high doses, some degree of the neuromuscular blocking property also. So just remember quaternary. Quaternary means some bigger compound, so it has a poor penetration, so stay longer, so has a longer duration of the action. Yes, थोड़े लंबे टाइम तक रहते हैं तो लंबा टाइम तक काम करते हैं, यही चीज है. And this slide is very important. This next slide is very important, so, because question may come from the ophthalmology part, question may come from the pharmacology part. Yes, so you can take the screenshot of these slides and revise. You can make the flashcard also. Yes. Now, so these are the drugs used in ophthalmology. Yes, midratric and the cycloplegic drug. Yes, so इसमें अपन पहले देखेंगे. Yes, tropicamide. So tropicamide, as the name suggests, tropica is the O for 1. So 1% we are using. And tropicamide T4, you can say too short to act. So this is shortest acting mediatic drug. Short, जब short लिखते हैं तो उसमें क्या क्या लिखते हैं, TT. So short means T means tropicamide. This is shortest acting mediatic drug. Tropica is the O, so 1%. And you can remember the PQRST. PQRST में T कितने नंबर पे आता है, 1 2 3 4. So 4 to 6 hour. 4 to 6 hour is the duration of the action. Now. So next is cyclopentolate. Cyclopentolate means cycle. So you can remember one cycle means the 1% and last for the 1 day. So just remember one cycle 1 day means you can remember 1% 1 day, 1% 1 day. Now homatropine is a homatropine. So you can pronounce homatropine like homatropine, homatropine. Homatropine means 2% यूज लिया जाता है और 3 दिन तक इसका एक्शन रहता है. Now atropine, we already know atropine T means time. So this work for the time is longest acting mediatrix और कब तक काम करेगी, T for 10 days, so action last for the 10 days. And this used in the A2 cute children. A2 cute children means atropine. Yes, so children's में ये use में लिया जाता है और इसका ointment काम में लेते हैं. So atropine is a double O, so ointment is used. A is the first letter, so 1% ointment is used. Yes. So concentration is also important, route is also important, time is also important, everything is important from this slide. Yes, so question may be asked from ophthalmology, may from the pharmacology. Yes, so atropine A is the first letter, so 1%, atropine is the double O, so ointment 1% ointment is used, has the T for the time, 10 days तक काम करता है, बच्चों में इसको यूज में लिया जाता है. Yes. Now, phenylephrine. So P for penta, so 5 to 10% is used, and these drugs are only mediatic. There is a no cycloplegia. Yes, so there is a no C in the spelling of the phenylephrine. So there is a no cycloplegia. You can remember. Yes. Now, so the few point about the atropine. Atropine initially causes bradycardia due to inhibition of the presynaptic M2 receptor. Further increasing doses, it causes the tachycardia by inhibiting postsynaptic M2 receptor. So पहले क्या करेगा ब्रेडिकार्डिया, बाद में क्या करेगा टेकिकार्डिया. यस, सो कहाँ पे यूज लेते हैं इसको, एवी ब्लॉक में या फिर डिजिटलिस इंड्यूस ब्रेडिकार्डिया में यूज में ले सकते हैं. यस, इसको SCLS, BCLS में भी ड्रग में यूज में ले सकते हैं. Yes. Now, so the more use of the anticholinergic drug in the COPD, we use ipratropium and tritopium. So tritopium is two selective drugs. Pre-anesthetic medication we use glycopyrrolate. It decrease the secretion and decrease the bronchospasm during the general anesthesia. And oxybutynin O4, you can remember oral side effect is there, so maximum risk of the dry mouth. And this is the shortest acting drug from the soft bladder group. Yes, we will see the what is the soft bladder. Now, trospium T4 tetra means this is a quaternary ammonium compound, and you can easily predict what is the feature of the quaternary ammonium compound. Just imagine like a fatty person, a obese person, a big person which cannot move easily easily, so poor penetration. Yes, you can say. Now, solifenacin is the L4 longest acting from the soft bladder group, and mirabegron. This mirabegron is asked in NEET PG previously. Mirabegron M is look like 3, so this work on the beta 3 receptor and used for the overactive bladder. So this mirabegum, this mira has the increased urinary frequency. Yes. So this is a soft bladder. You can remember solifenacin, oxybutynin, fluoxetine, fastiradine, tolterodine, trospium, and derifenacin. Yes, ये सारी यहाँ पे होती है. So oxybutynin is shortest acting. Solifenacin में L आता है, L4 longest acting. Yes. So now type in the chat box mirabegron. Which class? Yes, mirabegron is related to the which class and what is the use? Yes. Just type in the comment box. Yes, so this question asked previously about the mira background. Mira background में क्या आता है? M is look like 3B, so beta 3 agonist होती है and overactive bladder में use की जाती है. Yes. So many mnemonic given in the explanation of the pre-test question on the website and the app m3academymnemonics.com. You can sign up and attend the pre-test. And in the explanation, this mnemonics are available. So we are not repeating that mnemonic in this session. So you can solve the pre-test and easily add this mnemonic on your notes. Yes. So shall we proceed? This is audio visual is good. Yes. Now, so next is the ganglionic blocking agent. Yes, and this is the competitive and the non-competitive type. Competitive blockers is quaternary ammonium compound like hexamethonium and pentolium. So quaternary means the quaternary meaning quaternary is a meaning of the quaternary is 4, penta meaning 5, and hexa meaning 6. So you can see easily 4, 5, 6 drug. 4 means quaternary ammonium, 5 means pentalonium, 6 means hexamethonium. इतने से ही आपको ये चीजें यहाँ पे याद रह जाएगी. Now next you can say amine. Amine means methylamine and pempidine and monosulfonium compound like trimethophan and camphosulfone and the camphosulfone. Yes. Now, so trimethophan के बारे में कुछ चीजें. Trimethophan is a ultra short acting ganglionic blocker infused IV to produce control hypotension and lower BP in the hypertensive emergency due to aortic dissection. So this thing is important. Trimethophan, two short acting, ultra short acting drug. यस यूज फॉर द कंट्रोल्ड हाइपोटेंशन. यस कंट्रोल हाइपोटेंशन के लिए बनाने के लिए काम में लिया जाता है और ये चीज पहले पूछी भी हुई है. नाउ नेक्स्ट इज द परसिस्टेंट डीपोलराइजिंग ब्लोकर लाइक निकोटिनिक ऑन द लार्ज डोज एंड एंटीकोलिनेस्टरेज इन द लार्ज डोजेस. Yes, so these are the ganglionic blocker, and you can see the picture of the gang. This is a picture of the gangster. So you can easily appreciate the features of the ganglionic blocker by this seeing this picture. So when you see any gang, any gangster, yes, any terrorist, you can what is happening to you, you can easily assume while reading this. Yes, so your heart having tachycardia. Um, while seeing this gang, yes, this gangster or terrorist, your heart getting tachycardia. Yes, you may syncope, you may get syncope. So hypotension, your eyes become dilated, mydriasis, and you may have blurring of the vision because you cannot see such a such a fearful scene. So you can say a blurring of the vision is there. Yes, and next is the you may suffer from the constipation, decrease in the micturition because by seeing the gun of this gangster, you cannot go to for the micturition or the defecation. Yes, and you cannot perform any sexual activity. So impotence is there, and your mouth getting the dry. Yes, so dryness of the mouth, difficulty in the talking. Obviously, you cannot talk in the front of this gang, and obviously you get the sweating, but your sweating is inhibited. Yes, you are suffer the fear at this extreme level that your sweating is inhibited. You can remember and hydrosis. Yes. So just for the remembering purpose, assume this scene. You are the front of the gang and what is happening to you. This is a feature of the ganglionic blockage on the organ and this slide taken from the KD Tripathi. Now, so treatment of the smoking cessation already question asked in the NEET PG. Vernicillins. Vernicillins किसको block करती है? Alpha 4 and beta 2. In examination they can change like alpha 2, beta 2, alpha 1, alpha 3 कुछ भी change कर सकते हैं तो यहाँ पे याद रखना है alpha 4 and beta 2. So how you can remember alpha 4 A4 अधिक A4 axis means a बड़ा number so 4 आएगा beta B is a second alpha board so इसमें क्या आएगा 2 so अल्फा के साथ जाएगा 4 बीटा के साथ जाएगा 2 कैसे याद रखेंगे beta B is the second alphabet so beta 2 yes just half with the alpha so alpha 4 beta 2 selective partial agonist. Now, bupropion also used. Bupropion is a typical antidepressant, inhibit the reuptake of the Na and Da. Yes, NDRI होती है NDRI. So bupropion. So please revise the antidepressant mnemonic session from the psychopharmacology. Yes. Now, so next is the difference between alpha and beta receptor. Alpha antagonist is phentolamine and beta is propranolol. Alpha is a GQ, GI or GO, beta is a GS type. Yes. Now, next. Next is a beta receptor. Sympathetic receptor is the alpha and the beta. So beta is a three type, beta 1, beta 2, and beta 3. Yes. So we have one heart and two lungs. We have one heart means beta 1 on the heart, beta 2 on the lungs. Yes. And also beta 1 on the JG cell of the kidney. It release the renin. Yes. And यहाँ पे देख सकते हैं beta 2 we have one heart and two lungs. So beta 2 on the bronchi. Yes, and the rest of the organ like the uterus, like the liver. Yes, and beta 3, you can remember the triglyceride. Triglyceride is a tri means beta 3 receptor on the lipid tissue. Yes. Now, adipose tissue. Yes. So many of you already know this mnemonic. We have one heart and two lungs. वन हार्ट मीन्स हार्ट में क्या होगा बीटा वन लंग्स में क्या होगा बीटा टू yes now the agonist of the beta 1 is dobutamine you can say dobutamine is a O and B O for 1 B for B so dobutamine is a beta 1 agonist yes and antagonist is beta 1 cardioselective beta blocker metoprolol and atenolol. Beta 2 agonist is salbutamol, terbutaline. Yes, we already know. And beta 3 we already discussed mirabegron. Mirabegron. This M is look like 3. M is look like 3. Beta is B. So beta 3 agonist used for the overactive bladder. And this question asked previously in the NEET PG. Yes, mirabegron. Mirabegron. Now, mirabegron. Yes. Next. So next is this slide again taken from the category party. The summary of the drug acting through adrenergic transmission. Yes. So you can easily see in this picture. यहाँ पे देख सकते हैं कैसे इसमें transmission हो रहा है. Yes. Yes. Please comment about the audio. Yes. मेरा background block the M3 receptor. Yes. Very good, Dr. Ashish. Yes. I'm just changing the mic for the better audio quality. Yes. Now, so this is the pathway for the yes. So in this picture, you can see this tyrosine taken in the cell converted to dopa by tyrosine hydroxylase, and this is the rate limiting step, and this step is inhibited by metyrosine. This question also coming in your pre-test, also in the previously in the NEET PG. Yes, so tyrosine reuptake, tyrosine uptake, not a reuptake, tyrosine uptake in the cell and Tyrosine hydroxylase enzyme work on this. This is the rate limiting enzyme, and tyrosine hydroxylase inhibited by the metyrosine. Now tyrosine converted to dopa, dopa converted to dopamine, and the enzyme is dopa decarboxylase, and it inhibited by the carbidopa. Audible? Yes, thank you. Now, so this dopamine again taken in the vesicles, and this vesicle uptake is inhibited by reserpine, tetrabenazine, and valbenazine. Tetrabenazine and valbenazine. तो रेसरपाइन स वेसिकल स रेसरपाइन और वेसिकल दोनों को बोलने में आता है स रेसरपाइन और वेसिकल. सो वेसिकल में अपटेक को इनहिबिट करता है रेसरपाइन. यस. नाउ so next, this noradrenaline degraded by MAO, and MAO is inhibited by the MAO inhibitors. Yes, and this noradrenaline reuptake, reuptake is inhibited by the cocaine and tricyclic antidepressant. Yes, and now exocytosis of this neurotransmitter is inhibited by the gonadotropin and betalium. Yes, you can draw this diagram yourself and practice. Yes, so यहाँ पे देखते हैं दोबारा क्या क्या हो रहा है. Synthesis of the noradrenaline inhibited by the metyrosine, axonal reuptake inhibited by the cocaine, desipramine, and guanethidine. Vesicular uptake is inhibited by reserpine, vesicular reserpine. Yes. Now, so release is inhibited by betalium and guanethidine. Gun, you can put the gun and inhibit the release. Gun means guanethidine. Now, next is neuronal NF pool. Drug acting is tyramine and amphetamine. Yes, MAO inhibitor. MAO is two type, MAO and MAO B. So there is a non-selective MAO inhibitor like the mnemonic is PIT. Yes, mnemonic is PIT. Phenylcyclamide, isocarboxamide, or cyperamide, such drug. And you can say MAO B, selegiline used for the Parkinsonism, and COMT inhibitor, tolcapone, entacapone. So please revise the Parkinson drug pharmacology session now. So next is the drug mimicking the receptors. Yes, phenylephrine. So phenylephrine is a P, and we are using only one pen at a time. So phenylephrine P for पेन. सो पेन कितने होते हैं अपने पास? एक पेन होता है. P for पेन. तो एक पेन होता है मीन्स अल्फा 1 रिसेप्टर पर काम करता है. क्लोनिडीन इज अ डी आई मीन्स द डाई, सो इट वर्क ऑन द अल्फा 2 receptors. And isoprenaline, iso means sam, so it work only beta receptor, beta 1, beta 2, not the alpha 1. Isoprenaline. Dobutamine, we already see this work on the O means 1 and B means B, so beta 1 receptor. Dobutamine work on the beta 1 receptor. Now salbutamol, we already see beta 2 receptors. Phentolamine is a to means 2, so this work on the both the receptor alpha 1 and alpha 2. Prazosin work on the alpha 1, blocking the alpha 1 receptor. Yohimbine is a BI, so it block the alpha 2 receptor. Yohimbine, this question asked previously, yohimbine किस पे काम करता है? तो yohimbine में क्या आ रहा है? Yohimbine as a BI, so it work on the alpha 2 blocking. Yes. Yes, now next. Propranolol is a non-selective beta blocker, work on the beta 1, beta 2 both. Metoprolol is the cardioselective. Metoprolol M for myocardium. So this is selective for the heart. So only work on the beta 1 receptor. Yes, please revise the beta blocker session we already conducted. Now, so next is alpha 1 and alpha 2 receptor. Alpha 1 on the post junctional on the like one, eyes look like one. So alpha 1 is a GQ type, IP3 DAG receptors. Yes. Now, so next, this is the mind map for the drugs for the autonomic nervous system. Sir, please check the audio. Yes, please wait. Yes, audio is connected. Any problem in the audio? Yes, audible. Yes, please comment. Yes, audible from my side. No voice. Audible. Yes. Now, so yes. So in examination. यस सो ऐसे भी यहाँ पे फोटो दे सकते हैं उसमें एबीसीडी करके लिख सकते हैं कहाँ कौन सी ड्रग काम करती है नाउ सो दीज आर द फ्यू इंपॉर्टेंट पॉइंट अबाउट दिस सो वी ऑलरेडी नो बीटा वन रिसेप्टर वी हैव वन हार्ट सो बीटा वन ऑन द हार्ट एंड इट वर्क लाइक increasing heart rate increasing force of contraction increasing conduction etc now blood vessels you can remember the mnemonic a b c d so in blood vessels दो receptor होते हैं alpha 1 and beta 2 yes so alpha 1 causes the constriction of the vessels and beta 2 causes dilatation. So you can just remember ABCD. A goes to C, B goes to D means alpha 1 causes vasoconstriction, beta 2 causes dilatation. Beta 2 causes dilatation. Now so next is the beta 2 receptor causes detrusor relaxation. Alpha 1 receptor causes sphincter constriction. Now beta 2 receptor causes the uterus relaxation. So beta 2 agonist like retrodine used for the uterine relaxant and this question asked previously in INICT retrodine specifically किसके लिए use की जाती है and ये question आपके pre test में भी था. Now alpha 1 इजाकुलेशन पर काम करते हैं बीटा टू causes bronchodilation we have one heart so beta 1 two lungs so beta 2 yes now alpha 1 also work on the dilator pupillae muscle and causes the mydriasis am3 receptor causes the sweating and beta 2 receptor causes hyperglycemia by the increasing gluconeogenesis and glycogenolysis and alpha receptor also causes hyperglycemia by decrease insulin release now, next drug is dopexamine. Dopexamine, as the name suggests, इसमें क्या आता है D. D4 you can say it also work on the dopamine and B2 beta 2 receptor. And this phenoldopan is asked previously. Phenoldopan has a D, so it work on the D1 receptor used for the hypertensive emergencies. Yes, and which is drug used for the hypertensive emergencies? Hypertensive emergency में कौन कौन सी drug use में ली जाती है? Yes, type in the chat box. Oral drug कौन सी होती है? Parenteral drug कौन सी होती है? Yes, those attended our pre-test. There is a mnemonic available on the solution of that question. Yes, so there is a oral drug or there is a parenteral drug. Oral drug is NCC. Yes, nifedipine, clonidine, and a creptopil. And parenteral is sorrow ganguly for help. For help. Yes. Yes, sodium nitroprusside, glycerol trinitrate, furosemide, hydrolazine, esmolol, labetalol, and phentolamine. This labetalol also uses as the oral. So labetalol को अपन oral और parenteral पे use में लेते हैं. Yes, yes. सो हाइपरटेंसिव इमरजेंसीज के लिए कौन कौन सी ड्रग है ओरल इज एनसीसी नेफेडिपिन कैप्टोप्रिल क्लोनिडीन एंड लाबेटालोल पेरेंटल ड्रग इज सोरव गांगुली फॉर हेल्प सो सोडियम नाइट्रोक्लोराइड ग्लिसरॉल ट्राइनाइट्रेट फ्यूरोसेमाइड हाइड्रोलाजिन एस्मोलोल लाबेटालोल एंड फेंटोलामीन फेंटोलामीन यूज फॉर द चीज रिएक्शन क्लोनिडीन विड्रॉल इतनी सारी जगह ये यूज किया जाता है यस नाउ सो दिस इज द समरी फॉर द अल्फा एड्रेनर्जिक ड्रग्स Yes. Now time for the active recall. Yes, type in the chat box. Yohimbine work on which receptor? Yes, yohimbine work on which receptor? Yes, this question asked previously, so you have to answer in the chat box. yohimbine किस पे काम करती है? Yes, so next अपन देखते हैं यहाँ पे the receptor and the drug. So the adrenergic receptor has alpha 1, alpha 2, beta 2 and the beta 3. So adrenaline F for adrenaline, F for it work on the O receptor, alpha 1, alpha 2, beta 2 and beta 3. Yes. And use of the adrenaline is ABCD, anaphylactic shock, cardiac arrest, duration prolongation of the local anesthesia, epistaxis, and bronchial asthma. So in the anaphylactic shock, we use 0.3 to 0.5 ml 1 is to 1000 ratio IM means 1 mg per 1 ml concentration. Cardiac arrest 1 is to 10,000 ratio, 0.1 mg per ml intravenously. And for the prolonged duration of the local anesthesia, we use 1 is to 1 lakh concentration में use किया जाता है. Bronchial asthma, we use subcutaneous route 1 is to 1000 ratio. Yes, now. So next is noradrenaline. Noradrenaline is the A. A is the first alphabet, so it is only work on the beta. Only work on the beta 1, alpha 1, alpha 2, and in the beta only beta 1, not the beta 2. Yes, just remember. So noradrenaline is the Na. Na. So A means 1 तक ही काम करेगा, बीटा 1 तक काम करेगा, बीटा 2 पे काम नहीं करेगा. Now isoprenaline, iso means Sam. So only work on the beta, not work on the alpha, beta 1 and beta 2. Used for the heart block and the cardiac arrest. Dobutamine, we already know O for the 1 means 1, B means 1, so beta 1. So this is work on the beta 1. So this dobutamine not work on the dopamine receptors. Yes, it look like it work on the dopamine receptors, but this dobutamine is not work on the dopamine receptors. So dobutamine beta 1 पे काम करती है. Beta 1 is on heart, so heart condition like the cardiogenic shock by the acute MI, CHF and the cardiac surgery. Now salbutamol, levosalbuterol and terbutaline beta 2 agonist used for the asthma and uterine relaxant. Ritrodin is a specific drug for the uterine relaxant and also isoxaprine. Isoxaprine. Now, so next you can say phenylephrine and methoxamine is alpha 1. We already know P. P means pen. So we are using only one pen while writing. Yes. So this is a vasopressor agent used for the vasomotor rhinitis and the nasal decongestant or as the mydriatic. So we already see phenylephrine used as a mydriatic agent. Yes. Now nafazoline, oxymetazoline, and xylometazoline. So or the Jolene drug or the Jolene drug. Jolene means the joint. So this work on the joint of the alpha and the beta. Yes. So you can remember Jolene. Jolene means the joint. Joint action means alpha 1 plus alpha 2. Now clonidine is the dye. Dye means the alpha 2 पे काम करता है. Alpha methyl dopa भी alpha 2 पे काम करता है for the hypertension. Apraclonidine and brimonidine used for the glaucoma. Please revise the glaucoma mnemonic session from the topic group. Now सो बीमोनोडिन को बच्चों में यूज में लेते हैं क्योंकि ये सीनियर्स का डिप्रेशन करती है. ये क्वेश्चन भी पहले पूछा हुआ है. नाउ मेफेंटरमाइन वर्क ऑन द अल्फा 1 प्लस नॉरएड्रेनालिन रिलीज and used for the hypotensive state. Ephedrine is a mixed acting, means it acting on the alpha 1, alpha 2, beta 1, beta 2, direct action plus noradrenaline release inhibition, indirect action. Noradrenaline release is a indirect action, not yes. So ephedrine का mix action होता है. आगे देखते हैं अपन the alpha adrenergic blocking agent. Yes. So again this slide taken from the Caddy Tripathi alpha adrenergic blocking agent. Yes. So this is the non-equilibrium type like the phenoxybenjamine, and phenoxybenjamine is the dangerous name, bigger name. So this is the irreversible blocking agent for the alpha 1 and alpha 2 and used for the P4 phenoxybenjamine. P4 is used for the pheochromocytoma to control the hypertensive episode in pheochromocytoma. Yes. Now, so next is equilibrium type means a competitive antagonist. Yes, non-selective is ergot alkaloid like ergotamine, ergotoxin, imidazoline like phentolamine. Phentolamine is also blocking alpha 1, alpha 2, but reversibly. So, what is the use of the phentolamine? So, phentolamine used in the hypertensive crisis in the clonidine withdrawal and the cheese reaction. So, you can remember 2C, clonidine withdrawal and cheese reaction. Yes, दोनों के hypertensive crisis के management में use किया जाता है. Now, phentolamine also used in pipe therapy. Pipe therapy means papaverine, phentolamine induced penile erection, and this pipe therapy causes priapism that is treated by the phenylephrine. Yes. So examiner can cause this clinical question. Yes, erectile dysfunction patient take the injection of the this pipe therapy. Got the priapism. What is the treatment? So injection phenylephrine. Yes, and side effect of this therapy is also penile fibrosis. Penile fibrosis. Yes. Now, so next you can say the miscellaneous is a chlorpromazine and alpha 1 selective blocker. Alpha 1 selective blocker is all the synsen. trazocine, terazosin, doxazosin, alphazosin, tamsulosin, and sildosin. So this tamsulosin and silodocin is the uroselective drug used for the BPH, used for the BPH. Now, so this drug more selective for the bladder and less causing the hypotensive episode. And this alpha 1 selective blocker causes the postural hypotension in the first dose. So first dose effect of the postural hypotension. Tamsulosin causes the floppy iris syndrome during the cataract surgery, and this drug not preferred for the young male because this decreases the ejaculation, but it has a favorable profile on the lipid. Now alpha 2 selective blocker is yohimbine. Yohimbine is a bi means the alpha 2. So yohimbine and idazoxan, and this has no clinical use. Yes, so yohimbine का कोई भी clinical use नहीं है. साइकोलॉजिकल इम्प्रूवमेंट करता है इंपॉर्टेंस में, बाकी इसका कोई भी क्लिनिकल यूज नहीं है. यस, सो प्लीज रिवाइज द बीटा ब्लोकर निमोनिक सेशन. वी विल अपलोड दैट सेशन ऑन द ऐप आल्सो, एंड इफ you are registered member with the M3 Academy, you can join the Telegram community by the website or by the filling the Google form. Any way you can choose, and you can revise the beta blocker mnemonic session, and please attend the pre-test question. These are the high yield question designed on based on the previously asked question. Yes. So thanks for the participation. If you need any type of the mnemonic, you can ask in our Telegram group. Yes. So thanks for the participation.